very important prevention study to be done for a disease, esophagus cancer, which in any setting, any stage is very difficult to treat, and as said, often with poor prognosis. And so this is interesting to see what might be a benefit in terms of this combination with aspirin and higher dose PPI. And I agree with the conclusion that patients with Barrett's specifically should speak with their physicians about taking these drugs together in order to delay the events that were studied in this trial, and just want to stress that these are patients with Barrett's, and that we have to be very careful to not extrapolate to other settings, such as patients with symptoms of reflux but without a diagnosis of Barrett's.
Yeah, this is a really important point, I think, for you all to drive home to your audiences, because obviously these drugs are available over the counter, and we don't necessarily want patients to start rushing out if they have a little heartburn and start taking high doses of PPIs with aspirin without appropriate medical supervision. Barrett's is a diagnosis that can only be made after an endoscopy, so there has to be diagnosed by a gastroenterologist. And then, of course, based on those findings, it may or may not be appropriate to undergo this kind of a treatment plan. But even if it is, patients need prospective monitoring to see if the lesion is regressing or advancing. So although these are medicines that are commonly used and widely available, this is a treatment that really does need to be done under doctor supervision.